I am Jimmy Dills. Oh, there we go. That'll be the first thing on the recording. Hi, I am Jimmy Dills with the Georgia Health Policy Center. I work with Debbie and Christina and our team here as the backbone organization for the Georgia Span Project. And some of you maybe are coming in knowing exactly what you're here for. Some of you may have gotten invited to it and maybe you're curious. But this is an overview of what we're going to do here and in another session that's going to be on March 8th. We want to have these introductory discussions to strengthen the relationships and grow our collective understanding of the systems that the G-SPAN project is seeking to influence. And Debbie will give an overview of the G-SPAN project in a minute, so you'll get that context. But over the course of these two sessions, we want people to be able to connect and reconnect with your peers, with potential action team members and others vested in policy systems and environmental change in Georgia around nutrition. We want to grow the understanding of the G-SPAN project. We want to describe the parts of the system that are influencing nutrition through this tool called whole systems mapping. And that's what I'll focus my remarks on after Debbie gives the overview. And then we'll spend the majority of our time using that tool for everyone to share the work that they're doing out in the communities in Georgia. And that's really the value of today, is to get to that point of sharing, sort of structured sharing of what everybody's doing. Then as we move into the session on the 8th, that's where we're going to start thinking a little more deeply about key indicators that are going to inform our CDC-funded projects evaluation and hopefully help you all think about how you might find some synergies in the way you're measuring the success of your work. So we'll tee that up a little bit today. And then all this is meant to help everyone prepare to identify who should and be able to participate in a statewide convening that we're doing April 29th and 30th that'll focus on bringing all the parts of the G-SPAN project together to really interrogate the system. And the graphic there at the bottom is meant to sort of illustrate these CAT-specific meetings are meant to really start exploring the system, do some preliminary mapping of it, loose modeling, but really characterizing what's out there, what's going on. And then we move more into really modeling and a more formal mapping of that. And ultimately through that full convening, getting to identifying leverage points, the action opportunities. We're actually using these methods. So we're applying these methods to describe the system, and then we're going to use them to identify the synergies, the leverage points, the actions. What can we do based on that information? So that's the trajectory we're on. And over the next two sessions, the one today and the one on the 8th, this is what we're doing. Looks like people are already doing in the chat. We just want to get your name, title, and what's a nutrition-related topic that gives you passion? Why are you doing this work in the first place? And so part one today, we're going to be doing welcome and overview, kind of the housekeeping stuff there. I'm going to introduce and try to level set on systems thinking and the whole systems mapping approach. Then we're going to apply that. And like I said, that's going to be the majority of the time today. And that'll hopefully transition into a discussion about some loose next steps, additional CAT meetings that may need to happen. But know that more of that's coming as we have the conversation. And then when we get to part two in a couple weeks, this is kind of a preliminary agenda subject to change. This is where we're thinking about those measures and mindsets, really recapping what we do today, thinking about the mindsets under the work, talking about evaluation and measures, and moving towards those opportunities for action as we carry this forward into the statewide convening at the end of April. So again, this is the trail map of where we're going. And with that, I'll hand it over to Debbie to start talking about who's in the system, what are they up to? We're the G-SPAN team. Debbie, what are we doing?
Thank you, Jimmy. Welcome, everyone. On behalf of the Georgia Health Policy Center and the entire Georgia State Physical Activity and Nutrition team, we welcome you to today's discussion about nutrition. Many of you have been working with us for a long time. As you know, Georgia's been doing work in obesity, physical activity, nutrition since the late 90s, and some of you may have participated in our initial grants from CDC around this topic. At the time, they were called Planning and Implementation Grants, and I think our last grant was about 2004. So it's been close to 20 years since we've had CDC funding at the state level for this topic. We have colleagues on the call today who are entering their information to the chat who have been received CDC funding for a couple of rounds, and you'll get to know them later, I think, as we work on the systems mapping stuff. So in a nutshell, we just want to say thank you for participating in the planning of this grant. We had 2 partner meetings and we had more than 25 people representing different organizations on each of those calls. So clearly there's a lot of passion in our state. We completed our application. We requested the max amount. We are awarded the cooperative agreement in July, but then we found out that all of the states, from California to Rhode Island, were awarded the same amount of $888,000. We have submitted our year one work plan and budget. We had to make some edits because CDC had some changes to language and priorities. And so we resubmitted those in January, and we're waiting now for the agreement to be executed. There seems to be been some challenges, and we're not exactly sure why. But in a nutshell, part of the notice of award required us to give away some of those funds. And so I'm going to talk about how we're going to do that, so everyone is aware that the resources we're receiving as an entity is going out into the state in a number of ways. Jimmy, let's go to the next slide. There's a couple of things I think are important. Number one, Georgia is the only state in the nation to receive 6 CDC awards, and they're listed here. And again, we have representatives from Morehouse, from YMCA of Coastal Georgia. I'm not sure if DeKalb, UGA, and Houston are on the call today. Maybe they've joined since we've started. But kudos to all of the Georgia partners who applied for and were awarded what equates to almost $6 million a year for 5 years to the state. And the great news is that we know all of one another. We've been working together for a number of years. Paula and I started working together, I think, when we were 16, right, Paula? So we are excited to be able to,
I don't know.
so 18. So we're excited to be able to come together and partner collaboratively on this investment of $6 million a year to get what we hope is impact that will be sustainable and result in outcomes that we all want to see in Georgians. Let's go on. So here are the priority topic areas. Today, you're participating in the nutrition area. And a couple of things about this. In terms of staffing for these priority topics, nutrition and physical activity required the highest percent of staffing according to CDC requirements. And so Christina Bernhardt, our colleague who's with us today, will be coordinating nutrition, and Jimmy Dills, who's leading the discussion today, will be coordinating physical activity. And then I'll be doing breastfeeding and obesity prevention. You can see under nutrition, there are food service guidelines and fruit and vegetable voucher and produce prescription programs. Those are the priority areas for CDC, and we have partners on those, which we're going to talk about next. So the first way that we're investing some of our dollars is by contracting or providing sub-awards to collaborating partners with whom we've worked in the past and for whom we have a track record of achieving impact. And so each of the topics that are on the left, again, I'm doing obesity prevention and breastfeeding. Jimmy's got physical activity. Christina has nutrition. And then the collaborating partners are listed there along with the lead. So Monica Griffin from Quality Care for Children, we've been working with them for 5 years as a result of some W.K. Kellogg initiatives. Georgia AAP, Claire Eden, Kyla, I see you're on here. Kyla and I started working together when we were 16 as well in childhood obesity. So long-time partnership with Georgia AAP. Health Empowers will be the co-lead on physical activity. And then Wendy at Children's Healthcare of Atlanta, who's with us today, as well as Will Sellers from Wholesome Wave, Georgia, will be collaborating on the nutrition piece. So this is one way that we're actually investing in the dollars. The second way that we're going to be investing in the dollars is by making sure that we work on these overarching topics and partnerships to achieve change on equity, communications, and evaluation. And so representatives from Karna LLC are with us today, and they'll be helping us with the evaluation and communications piece. And our hope there, everybody, is that when you're communicating, regardless of what organization you're with, you're letting us know about those strategies and messages, and we can further that messaging for you through the Georgia SPAN initiative. So as you send out messages, we want to share those too, and we have an obligation to do that. On the equity piece, the Georgia Health Policy Center has an agreement with the Department of Public Health with funding from CDC around equity and achieving health equity. We have community of practice that was formed, and then we have high opportunity pilot areas. So we're working with public health and other partners on that equity piece. And many of you have a great deal of experience in equity, either at the local level, regional level, or state level. And we want to learn from that experience. So part of what we're going to be doing as we map this systems piece, especially in session 2 and in the April event, as we create an entire state visual of the work we're going to try to accomplish over the next 5 years in all these topic areas, our goal is to really understand where can we take action on equity that will get us return for the investment and get us return in the short term. We need quick action that has return quickly. So this equity piece is critical to all of us. I think we all share a passion for ensuring that all Georgians get access to the care and the services they need to achieve their best health. Let's go on. Everyone knows I'm passionate about this topic, so I'll try to move fast so we can get to the real work. We have 2 evaluation questions that drives our work from CDC. All of you've heard that phrase of policy systems and environmental change. That is our focus area. We're trying to think about the policies and activities that will affect local and state level change to improve healthy food access and eating, physical activity, breastfeeding, and early care and education outcomes. And then the second piece, all focused on equity. What approaches are being prioritized? And in our case, we're trying to figure out what will get us to the outcomes we need to achieve. Let's go on. Okay, so we are going to try to be measuring our impact, and CDC puts forth prescribed, if you will, milestones and measures. So I'm going to just give everyone a second to review those 3 milestones that we're expected to achieve in year 1. Now, as I said, we have people. Tally is here. Tally Breedlove is here with the UGA High Obesity Program Project. Paula Chrysler and Armand are here from Savannah. I'm sure there are others that I can't see, but they've already been working in these spaces for some time. And so we're going to be learning from them about the landscape that they've already mapped, and then we're going to be doing additional mapping. So then we're getting to measures. So these are the things that we're going to be measuring over the course of our work. It's a 5-year cooperative agreement. And we're looking at, again, state, regional, system-wide food service guidelines. Megan, I see you're here from the Atlanta Community Food Bank. One of our priority areas is to work in that charitable food system to understand food service guidelines. And the Atlanta Community Food Bank's already done an amazing amount of work in this space. And as has some of our parks and recs and WISE. So I think there's some amazing opportunities for us to move forward on these performance measures with work that's already being done. Let's go on. Here's the second nutrition area, the milestones there. Again, food systems landscape on fruit and vegetable voucher incentives. Many of you have already worked, who are working in the space, have worked with Wholesome Wave Georgia and Georgia Fresh for Less in terms of matching EBT at farmers markets. We do want to get into, hopefully, WIC farmers market vouchers and think about how we can integrate that into our work. And then we want to get an existing plan for expansion. I know that Will at Wholesome Wave wants to work on expansion in Southwest Georgia, where our food deserts and healthy food access are the biggest challenge. So that's something that's important to him, and we want to support Wholesome Wave as a collaborating partner in achieving what they're trying to achieve. You can see the performance measures here and the population reach goals for CDC. We are happy to share this slide deck with anyone who's interested in receiving it. We are trying to be openly transparent and make sure that people who are participating in these calls have access to all of the information that we have access to. And if you want additional information, we have put into the chat the general email address for GSPAN, so you can reach out to us. Next one. Okay. So part of what we had to do was create a work plan. All of the other CDC awardees in the state of Georgia had to do the same thing. They had to do a revised budget and a work plan to accommodate the dollar amount that was awarded to them. Again, in our case, $888,000. So the 2 things I want to share with you here. I mentioned one way we're giving away the funds, which is through our collaborating partners. They're going to be helping us coordinate the CATs and coordinate information collection for measures and milestones. The second way that we're giving away funding is going out into communities around the state of Georgia to gather information about what the 5-year initiative will look like in terms of evaluation and learning and adaptation, to gather information that's important to communities and that is important to us as Georgians trying to improve health. So we will be hosting community conversations, and the individuals who participate in those will be paid for their time. The third way that we're investing, and this will likely start in year 2, is through regional grant making. The collaborative action teams will come together, will create an application and a scoring rubric. We'll decide on the structure of that grant making. Our original budget had about $100,000 to $200,000 a year in grant making. Because of the dollars, we took a third cut, right? We went from 1.2 down to 888. So we don't know exactly how much we'll be giving away in grant making, but we are committed to grant making to invest in specific areas of the state to reduce disparities. So that's the other way that we're going to be giving away funds. Final thing, and then I'll stop chattering so you can get to the work, is that after these first two sessions where we're talking about the systems, the nutrition systems, what's happening? Where is it happening? Where are we missing things that could be happening? Where are there things that we're doing too much and it's not getting us the outcomes that we need? What we call these points of leverage. And the food system is massive. All of you know, if you've worked in our Food Policy Council stuff way long ago, our food system map is convoluted. And so what we're trying to get to after these two meetings is a third meeting of the collaborative action team members, and all are welcome who are passionate about nutrition to talk about this work plan and to say, how does the work plan mesh with my organization's goals for nutrition? And how can we improve the work plan for SPAN to make sure that it embraces what we're trying to do collectively in our state, so that you as an I want Paula to be able to claim our successes on SPAN, just like I want to be able to claim her successes on REACH, because we've collaborated to achieve change. And so we want to know what's in it for you, why you're participating, and make sure that we're getting that what's in it for you answer, that you're getting value from attending and giving your time to participate. So meeting number 3 of the Nutrition Cat will be about this work plan and how you as organizations interested in nutrition will benefit from participating, and how we also can benefit from your participation. And it starts today when you're sharing all the excellent work that you're doing. Any questions about GSPAN? Feel free to put them in the chat. Savita has loaded up the slides into the chat. Go ahead, Jimmy.
And Christina, Wendy, I don't know if Will is on. Do you guys want to share anything by way of context before we jump into the tool we'll be using and then using it?
I think Debbie did a fantastic job. Hello, everybody. I don't know all of you just yet, but I'm excited to make your acquaintance. I'm Christina Bernhardt, so I'll be working specifically on the nutrition strategy. The one thing I just want to reiterate that Debbie said is that we really want this. We want you to be able to get something from this as well. We don't want this to be a one-way relationship or a one-way collaboration. So in a few minutes, Jimmy's going to go over some systems mapping, and we'll be working on an activity together. That is a resource that we want to be able to send back out to you all for you to have and use in your own work as you see fit. So yes, please email us if you have questions. If you want to schedule one-on-ones, I'd be happy to sit down and meet with you. But yeah, just excited and want to reiterate that collaboration component. Wendy, do you have anything that you would add?
I don't have anything to add. I'm excited to be part of this group and see so many familiar faces and names on here. So I'm excited to hear more as we continue progress on this.
Great, thanks everybody. Okay, so move into the systems level setting portion of the afternoon, and recognizing that a lot of people have already done some kind of system mapping work. Debbie alluded to, others maybe haven't, others maybe have preconceived notions of what a system is. And so want to turn it on you real quick to just hear, what do you think when you hear we're talking about systems mapping? What is a system? What do you think of when you hear that terminology that we're using? Either feel free to come off mute and share verbally, or pop it in the chat. What do you think of when you think of a system? Or really a process, so thinking about processes. Yeah, Paula, go ahead.
I think it's more collective impact in terms of, and it could be both ends of the spectrum, because a system isn't always good.
Correct. Yes, gold star. Right. Systems are designed to get the outcomes we achieve, and we want to work to impact systems. We want to work collectively to have those systems be more impactful. And those are all related but distinct ways of thinking about systems. In the chat, we got various programs working together. Structure, yes, the interconnectedness of the system is really what we're trying to get at today. And then we get into what we call sort of the dynamics of the system, maybe a little more in the future sessions. Interconnected set of factors that can impact an outcome. Wendy, it's almost like you've been in some of these sessions before. Structure-based programs. Anything else others think of when you hear system in this context? Okay. Well, so we do a lot of the systems thinking, mapping, and modeling at the Georgia Health Policy Center with clients across the country, even across the world in some cases. And there's a wide variety of ways to do this type of work, to get at those connections, those dynamics, the things you all are describing. And I always start or try to start with this frame, that there's grades of these things. And people often jump to system models, that we have this really mathematical thing that we can put inputs in and get an output and test different options. And those can be very valuable. The one on the left is just a kind of visual example. The one on the right, though, is the Georgia Childhood Obesity Model that Debbie and others, I assume, on this call probably worked on. But it takes a lot of resources, a lot of information, a lot of time, and a lot of expertise to put those together to have this very impactful product that was actually used in the Georgia State Legislature to change policy. The legislators were able to look at different policy options and see, based on the evidence, how would those impact childhood obesity outcomes. That's a very powerful use of systems modeling. But again, that's the top of the mountain. If we go further down, you can get a lot of value out of mapping the system before you ever get to that full-on dynamic modeling aspect. And this is part of where we are today and where we're moving, is this mapping and identifying kind of space. So on the left there is an example of a whole systems map, which is what we're going to be working with today. In the middle is another one that the GHPC worked on, looking at Georgia's opioid system. And that was a powerful tool, again, for that group of perspectives to come together around opioid misuse issues and explore ways to work differently together to improve outcomes. And then on the right is another version that's a little more variable based, and you can just see how complex these get, because these maps are used to describe complexity. Systems thinking is meant to help us navigate the complexity that Debbie laid out of how complex the food system is in Georgia. We want to be able to describe that complexity to then help us better navigate that complexity. And the first step towards all that is a systems thinking mindset. And that's at the bottom of the mountain, because that's the easiest one to get to. It takes the lowest level of resources in terms of input and expertise. It's really just a set of questions and a way to think about the work you do and how it's connected to other people that work in similar issues or the same issues, in this case, nutrition. So some examples there are the 5 R's. That's just 5 kind of rules of the system. Just describe that based on results, roles, resources, rules, and relationships. And it's a simple way to start thinking about collaborative work. There in the middle at the bottom is a 6-question framework that GHPC developed based on systems thinking to analyze policy. And again, it's just a simple set of questions, but the way you think about how do these things interact, who's serving whom and how, having those written down, that facilitates this type of systems thinking. And then the iceberg is one of my favorites there on the right. It's a kind of rudimentary map, but it's another way to just get people talking and thinking about their work in the context of these systems. And we'll use that. I'll talk about that again in a minute, but I picture us using that tool a little bit more maybe in the future sessions, still to be determined. But going back to the definition of systems, this is a definition from Donella Meadows, a systems guru from the late 90s, I believe. And her definition of system is a set of elements interconnected in a structure that produces characteristic results. And it's key that there's 3 parts of that definition. It's a set of elements interconnected in a structure that produces characteristic results. So here, if it's the system is a car, you got all your elements there. You can structure them in a variety of ways. And here it's some neat looking sculptures that are great, but those aren't cars. That's not the system producing the characteristic result of a box with 4 wheels that moves people from point A to point B. And the key is thinking about what are those elements, how they're structured, and the results that are currently being produced, and the results we want it to produce. And how do we adjust those structures to get there? And the set of elements is really where we're at today. We want to sort of lay it all out on the floor. Who all's doing what in nutrition, And then our team's going to take that and start thinking about those interconnections, bring it back to you all so we start talking more about the connections and then ultimately moving towards those action points where we can really all get pointed in the same direction, working together and finding those opportunities for collaboration. Think of systems as system prizes, collaboration platforms, and ideas together committed to a goal. Yes, Georgia Academy of Nutrition and Dietetics, that's a good definition of systems. And so keeping the CAR idea as a system, it's really important to think about the boundaries and the way systems are nested within each other. We are all part of the system, a universal system, a global ecosystem, the system of, I don't know, Georgia residents. But those systems are too big for us to do anything with. We want to start thinking about what are the systems we work in that we control, and then how is it connected to other parts of the system. So here on the left, car as a system, there's a lot of subsystems within that car that make it work. The exhaust system, the mechanical systems, the electronic systems, the entertainment systems in the car. And each of those systems requires different types of expertise to make them all work well together. And a person, you know, the mechanic needs to understand that level of the system at the car level and below. How are all those interacting with each other? And how do you work on those structures to make sure that car system is working as well as it can? In the middle, go in the other direction, that's the highway system. So that system's made up of interconnected ways that these individual car systems are moving through space. And the expertise needed here is, you know, civil engineering, planning. It's a different set of expertise that influences the system at that level. They're still all interconnected, but that, you know, the muffler expert may not really be who you need at the table when you're trying to change the way the highway system is designed. And so it takes different levels of expertise at different sort of levels of these nested systems. And then on the far right there is an even broader transportation system. So moving away from just cars and lanes of roadway, but thinking about how does freight move? I know we got some folks on here from the coast, all the ports, that's part of the transportation system. How do all those goods get onto our roads and into our stores in the state? How does that happen? Transit in the middle, a different type of transportation mode to move people, bicycles, walking, really thinking about all the different modes of transportation in a transportation system is slightly different from only thinking about the interstate system that moves cars or only thinking about the car itself as a system. And again, people on this call for the nutrition system all have different, but again, connected sets of expertise that are going to make your work impactful at different places in these nested systems. And so when we're thinking about the boundaries of the systems we work in, that's a real key part of what we're doing here is what's happening for nutrition and the food system in Georgia. What parts of that are we able to actually work in and adjust to improve the outcomes that we want to see? So we're all working in systems. That's the key there. And then this one I still like to have here because rarely do we get to redesign a system from scratch. More often than not, we're working to change something about an existing system. So we have a food service system, a nutrition, however you guys want to frame that system in Georgia. But some of the outcomes aren't working for some people in the system as well as they could or as well as they do for others. So let's look at the structure of that system. How can we change that? You know, here on the left, the table, they didn't get rid of the table or go to a different restaurant. They found a chair that the structure of that chair helps whoever's sitting there be at that table, be at that level. And so that's meant to just, you know, kind of tongue in cheek convey the way you can alter the structure of a system. That's what we're really trying to do to improve the outcomes. We're not throwing the bicycle away or throwing the table away. We're looking at it, we're examining how it's connected, the outcomes we want to see, and then what do we need to change to get to those outcomes? A key part of systems thinking and having these collaborative conversations is hearing what other people think of the system. And that often gets called the mental model or sometimes mindsets about the system. But these system mapping and systems thinking activities are really only as effective or really most effective when you're talking to other people that share a perspective or have a different perspective on the same system. And then you're starting to understand how other people understand the system. And that's how we can build collaboration through these types of systems, thinking and mapping, and ultimately a little bit of modeling that we're going to be doing through this project. So the iceberg, this is one of the common metaphors in systems. And this is one of my favorites. So I'm like Debbie, I can get real energized about this. So I'm just going to try and give the basic level that there's events. If you think of the iceberg as a system, the thing that you're seeing are obesity rates, are malnutrition numbers, those types of things are the headlines. That's the event. That's what the system's producing. That's what you see. To do the system's work, you have to start going underneath the surface and start thinking about, well, what accumulation of behaviors, what patterns of behaviors have led to that event? And that could be individual or population level behaviors or behaviors of the system. The system is doing something that's producing those events. But then deeper down in the system, below the behaviors, are the structures of the system. And that's where we're really trying to key in today and through this work, is thinking about what structures, policies, environments, systems, to use the word again, but really are setting the context for those behaviors. And how can we work to alter and move those structures to facilitate the behaviors we want to see to achieve the events we want to see and avoid some of the negative ones. Then the deepest level in this model are the mindsets. That's the way people think about this. Everyone has a right to healthy food. That's a mindset that if you are thinking that, or that's a mindset in the system, that sets the context for the types of structures you're going to be able to create. If you all agree that healthy food is a right, then your policies are going to reflect that. If you feel like, healthy food is a luxury and, you got to be able to pay for it, if that's your mindset, that's only going to open up a different set of policy options for you in that structure. So the mindset's the really high leverage place to get change, but it's also the hardest to target. And it's really where these changes in structure, where the collaborations happen, to see some of the behaviors change, the information from that and success there can feed into the long-term change in people's mindsets. And then going down the left, that arrow represents the leverage kind of going down the system. You can react to events. You need to react to events. But deeper in the system, you can start to anticipate the behaviors. You can design the systems and you can transform the mindsets. Designing systems is where we're at when we're talking about policy systems and environmental change through these types of awards. And so the two specific sort of structures we're working with under the SPAN award are to implement state level policies and activities that promote food service and nutrition guidelines and associated healthy food procurement and facilities, programs, and organizations where food is sold, served, distributed. A lot of words there, but that's describing a part of the system. Those state level policies and activities are the structures and the systems that we want to start analyzing and figuring out how to move towards a structure that better supports healthy behaviors, better supports healthy outcomes as the events. And then the second related nutrition strategy there is coordinate the uptake and expansion of existing fruit and vegetable voucher, incentive, and produce prescription programs. So those prescription programs, those incentives, maybe they're what we call small p policies, but there's still things that are structures in the system that then influence the behaviors of people to be able to actually access those foods, eat those foods, and hopefully achieve the healthier outcomes because of that. So again, structure, that's what we're looking at today, is really trying to see each of us, everyone on this call, you represent yourself or you represent an organization or an agency. You are an element in the system. And so that's going back to that car metaphor. This is where we're laying out all the elements, who's doing what. And then we're going to start to think about how we as people working in this space are interconnected as the structure of the system to then guide us towards some of the most impactful outcomes. So to do that, we're going to use whole system mapping as a tool we've used starting to be pretty extensively in some of our national maternal health work. So shout out to the Maternal Health Learning and Innovation Center that some of us are a part of on this call. But this tool has been used before that by others. We collaborate with folks who are using this across different type of topics. So the examples here come from a maternal health standpoint. It's very transferable to a nutrition, chronic disease prevention kind of perspective. So whole system mapping is really just a table. It's thinking about the right questions to ask in a table as you think about different roles or different people, different agencies in these systems. What are they doing? And then it helps sort of the airplane up there is meant to signify, get that 30,000 foot level view of this complexity, this system that we're all in. And the product is that table that Christina referenced. We want that to be a living resource where people can continue to add to and reflect on. And, we're going to work to organize that and make sure it's in a readable way for everybody to be able to use that to identify your partners, identify your collaborators, be it under the SPAN banner or some of your other work that you're doing, some of that other nationally funded work or other local initiatives you have. These can be powerful tools that are very transferable. So it's table, each row there's a different group. I'm kind of going through this quickly because it's pretty self-explanatory once we get in there. We got a lot of folks on here, so we want to be sure to hear from everybody. But the overarching steps of the process are to set the boundaries for the system you want to map. We're moving towards, nutrition systems in Georgia. You all know that content much better than I do. So you may be able to put different bounds on that or articulate that in a different way. Or what is the system we're trying to map here? Then identify the information we want to include in the map through the questions. Our team, in collaboration with some of the partners, have already done that to get some basic questions in there, but certainly want to encourage you all to add additional questions you would like to see in some of this work if you have them. And then 3 is sort of what we're doing right now. In other iterations of this, people have used, surveys to ask these questions of a large group of perspectives. But here we're doing it in this group, and it's getting those different perspectives on the system. Where do you fit into it, and how do you see others fitting into it? Combining that into a single table, that's where we're getting today. And then we're going to be analyzing the results a little bit today as we have just the conversations and talk about it. But that's really what's coming up next is what do we do with this? How do we identify those gaps, duplication, opportunities for collaboration, that type of action identification, and then planning next steps. That's what subsequent meetings will really focus on. And the equity considerations and using this and any other of these systems thinking tools is who all is at the table sharing their perspectives, who's missing, and are we getting the perspectives of, often it gets called the end user or the person with lived experience, but the people out in the communities we're really trying to serve, what is their perspective on the system? And that's how you bring in that equity dimension, is really trying to, again, get as many perspectives on the system as you can, so you have the deepest understanding you can get of how the system works and how then we can influence the system towards the better outcomes, the more equitable outcomes that we want to see. So just some quick examples. Like I said, they're just tables. So here's mental telehealth as an example. We got university telehealth, caring counseling. These are kind of hypothetical, but thinking about what services provided, where is that provided, who receives it, how is it paid for, how many people are served, how do you measure success? Our questions are similar to this. Here is a more in-depth example where we used with some of the HRSA-funded maternal health awardees around the nation. They're all responsible for setting up state-level maternal health task forces. And there's a lot of perspectives that need to be on those task forces. So we use this tool with them so they can start thinking about, okay, who all in your state touches on maternal health, touches on the issues that we're worried about, and then who are they? What do they do? How are they funded? How can we connect with them? And this really helped that group, that group of states think about, what does the system look, what does the maternal health landscape look like in Georgia, which is one of the funded states? What does it look like in Wisconsin, which is another one of the states? And be able to populate that with, not hypothetical, but real information from the system, from the people that are in the system that are part of that structure. And that's what we're trying to do today. So we're going to make our map, and I did not pull up my link. So hopefully I just click on this and it works. But we got it in a Google Sheet, which hopefully most people can access. If you have trouble accessing it, just let us know. You can answer the questions in the chat or just come off mute and share, and we'll have somebody type it into the document. But this was the best way we could come up with to have one document most everyone could be able to work in at one time for the purposes of this exercise. So we're going to open that up. Well, I'll pause and ask if there's any questions, but we'll open that up, let people get in there and just start populating for your agency or organization. Look on the left to see if you're already mentioned. If you are, start filling in those rows. Talk with your colleagues if you're here from the same organization. And if you don't see yourself on there, put in a row for your organization or your perspective that you're bringing and answer the question. So we're going to give you guys 5 or so minutes to populate that on your own. And then we're going to go around and share what everybody put in. And that's the sharing part where we're going to hear how everybody sees themselves in the system. So let's see, do that. And it opens right up. So hopefully you all are able to get into here. Try and show a little bit more. See a lot of folks in there already. So we'll pause. If there's any questions, just speak up and ask, or ask in the chat. Otherwise, take about 5 minutes and start filling in. And again, you don't have to write a whole paragraph, not an essay, but really think about what are the policy systems, environmental things you're working on now in the nutrition space. What geography do you serve? What are the settings you're working in? Are there specific populations your group is focusing on? Are there key community leaders you might be able to connect the broader network to? And how, and just some thoughts on how do you measure success? And that's where we'll be going with these future meetings. And I'm going to stop talking, I promise, in a second. Oh, and then the last thing up at the top, just to keep it in the context of our GSPAN work, that's the CDC determined goal and the overarching strategies that we're working with here. But again, that's what we're working on, and we want to our team wants to understand how that's interconnected with what you're already doing, be that through some of the other CDC awards or other work that you're doing in your community. But that's meant to sort of just give you a little bit of a broad context of the types of things we're looking at in terms of policy systems and environments. So have at it. Looks like folks are rocking and rolling in there. We'll give you about another couple minutes and then we'll start talking about it. Hey, thank you everyone for participating and playing in our whole systems map. And those of you that either are on the phone and traveling and weren't able to get into the document, we still invite you to try to pop things in the chat or come off mute when we get in the discussion, and you can share for your organization and we'll have somebody from our team make sure you get a row in our table here. So who would like to share what they put in the table first?
I'll go.
Great, thank you.
Sure. So hi, everyone. I'm Kashi Sehgal. I run a company called Rataza. We're a local food distributor. So we connect food that's being grown at the farm level of all sizes with people, organizations who need it. So we are really interested in food nutrition access. We are operating community markets in and around Atlanta and also statewide. We've got a mobile market, so we're very interested in connecting fresh, locally grown produce and also proteins and dairy with people who need it most, our neighbors who need it most. Again, we're working statewide, and at some of our markets in Atlanta, we've got some great community health partners, some of whom you've mentioned on this call: Wholesome Wave Georgia, American Heart Association, Fulton and DeKalb Hospital Authority. We're offering wraparound health services at these community markets to make the food the sticky part, and then being able to offer everything else that could be helpful to people. So that's what we're doing.
Awesome. And do you get down to the level of the community leaders, and or how do you know when you've been successful? How do you measure success?
That's a great question. So when we show up with a community market, it's because we've talked to community leaders for a long time. We're not just coming in with our own solution, but it's working, in the metro, it's working with NPUs and churches and community groups to understand what the need is and how we can be successful. Is there a need? In parts of Atlanta that are very popular to help right now, we don't feel like we need to be there as another solution. We can go somewhere else. So it's always with the community. We're there for a year. We're not coming every 6 weeks. We show up at the same time every week for 52 weeks because we want to become a tool for that community to really use as a tool for growth and economic growth and neighborhood health and all of the things that means. So, we're 6 months in and trying to measure lots of things, like how many people are using the SNAP and EBT access that we have. What does shopping look like over time? How many people are coming back as a repeat customer? Are we changing behaviors? What is the community saying? Consistently talking with community groups to make sure we're understanding what they're hearing. So this is definitely an effort that we do with the community. We couldn't do it without them.
Awesome. Great. Thanks. I want to pick up on something I'm hearing thinking about the community markets as your setting. And then my brain goes to that. That's a physical structure that's a part of the environment that we're talking about here. And so there's having those community markets in the first place. What are the policies that get those there? How are those designed? And then it sounds like where you guys come in is then what are policies about what's there? What kind of payment structure or payment options do you accept? That's a policy. That's a part of the structure. And so you guys are working in sounds like a very specific type of structure in this system to then try and have that connect to all these other systems. And I love that list of successes you listed off there of sort of things to measure, because that's, I think, really getting to what we want to see in the world. Who would like to go next?
I can go since I'm traveling.
Sure.
Michelle Gambon. I am the Mary Poppins of Compost and Recovery for 13 years. I have been composting in the schools. I work in the nutrition department. I am a free agent that I go around with buckets and raise up the ambassadors who collect the food, make it safe to take, available for others. And then we use composting for education ties and curriculum push-ins for students. So I make turning compost in icky stuff cool and fun.
And you said you're a free agent, so you don't have an organization on the chart.
So my nonprofit is Community Sprouts, and my for-profit is Go Grow. But I overlay with Foodwell Alliance, Georgia Organics, Georgia Farm Bureau. That's just where I was at the Capitol. And then American Community Gardening Association. Those are my primary organizations I serve.
And so how do you think about success? How do you know when you've been successful in your role?
Early on in the middle years, some of the ambassador work would stop because of the bullying that would happen and the derogatory comments and the teasing for students that were ambassadors around with buckets. But now there's enough resilience, one, for time, two, because they realize they get out of class, that I actually have the cool kids composting. And actually now I have to manage students' academics, that they have to be, in good standing behaviorally and such, to be out managing and building the compost and growing in the garden. So there's been a shift from it being something that was teased and demeaned to that upside down thinking is shifting, where it's something they want to be doing with their time.
Yeah.
Plus, my reach is bigger. I'm in more schools, more organizations.
Yeah, that's awesome. And I'm trying not to do this for everybody because I'm just hearing so many different systems, and I validating what Debbie said and what you all know. These systems are complex because, Michelle, you're talking about, is one aspect of the food system composting in a setting in schools, but then you're working with the social systems of the kids and how, getting the cool kids to do it as a kind of a social marketing methodology to get more of the behavior you want to see. And so just between the two we've already heard, I hope you're seeing how dispersed this group can really be in terms of parts of the system we work with. And then ultimately, how it'll be valuable to look at this whole system map and start to think about, how are we all working together in the same direction? And that's not to imply that it's not happening, but just I'm excited to hear, just in the two stories already, the different parts of the system that are still all working together here in Georgia. So thank you for sharing, Michelle, and drive safe if you're traveling. Who would like to share next?
I can go.
Sure.
My name's Erin. I'm with Small Bites Adventure Club. We're based in Atlanta, but we serve statewide. Our mission is to help children discover, eat, and love fruits and vegetables, and we do that by making turnkey tools for teachers to help them lead hands-on cooking with fruits and veggies. We work around, we're looking at the problem: how do you provide high quality food education resources to teachers on the front lines? And we primarily work in ECE and after school programs, some K2. A lot of times we work directly with SNAP Ed agencies such as Health Empowers and Open Hand, which are doing the important direct work. So we're just kind of like a tool that they can use. And the way that we measure success is we are focused on, how many kids are participating, how many teachers are participating and being trained to lead hands-on food education for sustainability. And one of the main things that we're looking at is the increase in confidence that teachers have in leading hands-on food education.
Right. Increasing confidence. And that's I don't call it a squishy measure, but that's, increasing teacher confidence to deliver this. That's not on the CDC headline of measures, but it's a really important measure for success for where you are. And I love elevating the teachers as community leaders that they're in a large part of this. They're on the front line of this education, of implementing some of these strategies in the classroom. So thank you so much for sharing that. Who would like to share next?
I can go for Healthy Savannah. I have my two other lovely colleagues on the call too, Paula and Armand. But Healthy Savannah, we're a REACH recipient. I know Debbie talked a little bit about that earlier. So one of the things we put on here, obviously all our work is focused on PSE. But one of the big things that we're working on right now is the Savannah-Chatham Food Policy Council. So we're working on reestablishing the Food Policy Council. We work locally in Chatham County, that's the area that we serve. And because we're a REACH recipient, we work in nutrition, physical activity, breastfeeding, and adult vaccinations. So we have a big, broad kind of spread of the work we're doing, but what relates specifically to the food landscape is our nutrition work. And then the Savannah Chatham Food Policy Council, of course, is going to be made up of lots of different community experts from across the food system. As you've all alluded to in this call, it's a diverse system that has multiple pieces that we want to make sure that we're working with, collaborating with, and really ensuring that we're collaborating with the community and continuing to listen and learn so that we can put our best foot forward as a collective when making some of those policy actions or asks before city and county government. And I guess how we measure success, at least in the Food Policy Council, will of course be the passage of policies. That's going to take a little bit more time just to make sure that those things are going well. But as well, measuring success too is ensuring that we have health equity at the center of all the work that we do, that we're focusing on equity and diversity and having those conversations as we move forward as a Food Policy Council to ensure that we're informed in the best way possible. And Paula or Armand, if there's anything you all want to add, feel free.
You did fantastic, Ruby.
I agree with Armand.
All right.
So you got my cheerleaders here with me.
Yeah. Well, maybe they could help you with my follow-up question. Because this is great. And then again, just thinking like Food Policy Council, that's a very specific structure to have in the system that can then influence those policies. And my question is, can you just give the group an example? What's a specific policy maybe that Food Policy Council has either gotten passed or is advocating for?
Oh, go ahead, Paula.
No, feel free, Ruby.
Okay.
Yeah.
Yeah. So, I mean, Paula may be able to speak to a little bit more of the history of the Food Policy Council when it was initially activated many years ago. But I guess we don't have an exact list of specific policies we're moving towards. Through all our community conversations, one thing we've learned is folks really want to understand and prioritize community gardens within their communities and neighborhoods. So one of the things we want to do as a collective is just explore, what ordinances, what policies are already in place in Savannah and Chatham County that may make it easier for folks to have a community garden or maybe a barrier. Because it all depends on whether you have it on a city property or private property. There's different kind of requirements based on that. So that's one of the things, but of course we'll focus on many different policies in the future, and that will be part of the learning process from community members, from other experts in the food landscape to really move in the right direction. And Paula, if you wanted to share some of the other ones.
I'll just jump in with, because we've had several, there's a long list of actions that we've been able to take, that policies have been implemented, but the one that I think maybe best exemplifies this work is the farm truck that's associated with the Forsyth Farmers Market. So there was a policy action way back in 2009 that allowed the Forsyth Farmers Market to actually set up in Forsyth Park. So that was a policy action. But then when it was time to implement the farm truck, there were ordinances for the city that said trucks can't go around and sell stuff on the streets. And so we had to go to the Metropolitan Planning Commission and get, that ordinance change, basically to allow in zones where the truck could go. And then we had to go to city council and get the policy. And so there's actually a farm truck ordinance at the city of Savannah that allows the farm truck to go sell their produce in underserved areas. So to me, that's, one of the most exciting ones that has happened over time. But there's the animal control ordinance, community garden policy at the city and state level. We've done some at the school district around vending, stuff like that.
Yeah, that's great. And I really appreciate you sharing. And Debbie, I'll let you in a second. That I just want to reflect on the different aspects of the system, getting a farm truck policy written, then you're also engaging with community planners. And that's a whole nother system in and of itself that connects in a bunch of different ways. But in this case, specifically to what are the zoning and the ordinances that maybe restrict or facilitate being able to even have this in the first place. Having it in Forsyth Park, that connects to some of our physical activity work, which is about trying to, increase access to everyday destinations. A park is an everyday destination. If you're getting all the policies stacked in the right way that allows that great resource to be accessible by as many as possible, that's the kind of overlapping intersections we're really trying to push towards here. So I was needling you guys a little bit to share some of that, because I had a feeling you were going to touch on all those different aspects. And then the school systems, that's a whole nother set of, a nested system in which a lot of us are working. Debbie, what were you going to add?
Just, I do think there's a couple of things here that are important. One is one of the most important regional level policies that have ever been passed in our state is the tobacco policy in Savannah. And the impact of that particular one on health outcomes is something for us to set up as a shining example. This is not to demean all of the other successes that people are having, but we are trying to get to improved health, equitable access, equitable outcomes. And in order to achieve that, this group in particular is going to have to think very carefully about which policies they pursue. And so, yes, we want quick wins and baby steps, but at the same time, we also want to be working collectively to choose those things that we know will ensure that Georgians who do not have access, who do not have great health outcomes, will be better. So this is where we have to use our system to find those points of leverage. And Savannah did it with tobacco, and they're doing it with other things. But I think as a state, our team here is going to have to think about what's the most leverage.
Well said, Debbie. Thank you. Thank you. Healthy Savannah. All right. Who would like to share next?
Jimmy, I know Kia is here. Kia, are you here? Can you hear us? You probably have 56 things happening at the same time.
I do. I try to send someone to all the meetings. I'm like, oh, I'm in 17 places. I was at the Capitol yesterday, so I apologize. And
No, I just wanted to make sure, even if you didn't have a chance to populate the table, Kia, because you're leading chronic disease and there's a ton of nutrition stuff happening.
Yes.
I just wondered if you could give us a quick overview of some of the nutrition priorities that you have within DPH chronic disease, so that we can, all the partners today can hear them. There's 37 people on the call, so it'd be really fascinating to hear that.
Gotcha. Well, I tried to populate something else. I'm trying to type and talk and type. So what I'll say first is that one of the things that we're very, very fortunate about with Master Settlement funds and dollars, we've been allotted funds and resources to have a chronic disease prevention manager in all of the 17 health districts. They're 18, but 17 actually receive the funding. One of them doesn't receive our funding, but still does the work. Under that current work or initiative, we've been very, very fortunate to have a sustainable work plan that allows our health districts to truly use the community health improvement plan and the national prevention strategies to design interventions around nutrition and physical activity for their particular district. And again, they're kind of all doing something different. Depends on the priority inside the space of their health district and health director and what they see. And sometimes it may change from year to year. Sometimes we try to encourage them to stay in the community at least three to 5 years to have a true impact inside that space. But again, depending on what may be rising in their space, it may have different priorities. This is just one instance of work that we do. We also partner with the Department of Human Resources, who's actually on here. We actually receive their SNAP funding as well. So we are also, in addition to the work that's happening from our chronic disease prevention managers, there's also some pairing of work that we're doing with SNAP, where we're doing some direct nutrition education services, in addition to building some community gardens for health districts. I haven't put that on here. Then we also have a diabetes prevention grant right now where we're targeting 2 communities this year. We're looking at Columbus and we're looking at Clayton County. And in this space, we are actually working to focus on we haven't set the curriculum yet. We're doing this first next 4 months. We're actually doing an assessment to design and see what actually curriculums are out there that are working towards childhood obesity and which ones are actually working inside those spaces and what the community actually needs. We'll be doing an assessment for these next 3 months. After these 3 months in July, we'll launch actually an intervention that is targeting families and children to reduce obesity. We have 4 targeted curriculums that we were given by the CDC, but we can actually, if we find one that is working well for a community or in that community and want to partner and further that initiative, we can propose to the CDC that we can use one of those. Let me see. And always in the space of physical activity and nutrition, I know tobacco is not necessarily in this space, but you cannot leave it out of this space, right? So I'll work in tobacco. We are currently, our goal and focus, we're wrapping up our 5th year. We're coming to end, so our new cooperative agreement will be coming out. So our direction in that space will be a little bit different, but we do have a tobacco toolkit that we're about to launch for, well, I'll take it back. We're in the process of getting it approved to go through the process of getting it launched. That will be working, that will be targeted for schools. We have a lot of requests from schools to figure out how they can tackle or what they can do around tobacco prevention. So we're having some recommended curriculum and strategies for schools to use. We're not getting to the enforcement space, but we're also we're staying heavy in the prevention and the education component of that area. I think, Wendy, you're on the
Thank you,
call.
Kia.
Anything else that I'm missing? Wendy, you're she's the deputy and over this work too. Am I missing anything, Wendy? I think she's on the call. Yeah, she's here.
Thank you, Kia.
No problem. Is that enough?
Yes, that's plenty. That's great. And oh, Wendy, you're in the chat. Do you have anything to add? Can't come off mute for some reason.
Okay.
Well, hopefully we'll get that figured out. But I think something to think about here is as we think about these interconnected systems, it's like federal funding through the state Department of Health into communities that funds programs. You talked some about assessment too. That's a role in the system to characterize things and target the interventions. So I think, again, I hope people are picking up on the different angles, the different perspectives on this bigger system that we're talking about, and how much we really are interconnected, and even if we're not measuring the exact same things, we're still working towards healthier conditions, healthier Georgia, healthier outcomes, as Debbie teed up. All right, who would like to share next as an element in our system here?
Hi, this is Kyla. I don't mind sharing.
Great, thanks. Tell me your organization and go right into it.
Hi, I'm with the Georgia chapter of the American Academy of Pediatrics, and I apologize. I've been toggling back and forth because I'm working on an RFP right now. And, someone recently said, you're not truly multitasking because you're not giving 100% attention to all items, but I'm toggling back and forth because I'm here because it's important. So I appreciate this work, and I appreciate that Georgia got funding to be able to work in this space. And, with what we do, it's primarily the medical community. We work in pediatrics, but of course, that means working with everyone in the family, not just the kids. And in this space, we have been working through food security, working through WIC, federal nutrition programs, food quality, being able to help children, all aspects of nutrition, whether it's acute or chronic-based conditions. And with the work that we've been doing probably in the past 5 years, it has focused on food security and being able to build partnerships and how we can empower our pediatricians and pediatric staff and provide incredible nutrition recommendations, access, and resources to help directly their families that are going through access to food issues, food security issues, also clinical practice guidelines for the prevention and treatment of obesity. So, in the aspect of the medical part, but also the community building part as well. I think when Debbie mentioned, as we think about our goal here, developing policies through this group and what will have the most leverage, that's the piece of it that I sit here pondering, what is it? You know, what's the most important ask? And that's always difficult because so many things are important. But as we pull together the different groups, I do think it's great. I'm learning so much here about what some of the more regional or other groups are doing, which is helpful in learning how we fit in and how we can partner and collaborate together. So that's a little bit of what we're doing.
Awesome. Thanks, Kyla. You even took the words out of my mouth of what I was going to react to. So thanks for doing that. Yeah, so nothing to add. That's great. And happy you're here, and good luck with your funding proposal that you're multitasking towards. Who would like to share next? How about Sharon Rhodes?
Hey, Jimmy.
Hi, I'm picking on you because you're on my screen.
Well, and that's okay. I'll do my best. And as a consultant, I work with several different organizations or individuals. So let me go to my own section here. I know you're focused on the screen here, but let me find myself. Here I am. Okay, so I said increase access to healthy eating opportunities and long-term change through various outlets. So looking at it from a PSE perspective, there's one goal of long-term food nutrition security, but also there's the nutrition education and making that long-term change. Whether it's new knowledge or new experiences where whether it's the young childhood population, early care to K-12, where they get to experience taste testing and fruits, vegetables, and healthy foods, or if it's the community. So the other population working with, whether it's some of these organizations that provide farmers markets, and they're trying to provide some of these fruits and vegetables to the food desert areas and helping them obtain some grant funding. So looking at it from grant funds, free resources, and then of course, as a registered dietitian, services that dietitians provide that they would have more access to. So one of the other volunteer positions I have is working with the state, Georgia Academy of Nutrition Dietetics. Cicely Thomas is on the call. And then also GATA, Cheryl Steep, the president of the Greater Atlanta Dietetic Association. So both of those, working with both of those organizations and trying to increase access to what RDNs are providing across the state. So yes, it's statewide, and settings would be all over. So early care to school settings to healthcare organizations. Some of these organizations are trying to provide free food to hospitals and doctor practices. And then I was a little, because it's several different entities, I was not quite sure what to put for which community leaders to bring to the table. When you look at it from GAN and GATA, we want more dietitians that provide these services that could help connect some of these recipients to that across the state, especially those areas we've talked about like Southwest Georgia, some of these other food desert areas, and medical professionals. But then when you look at it from a early care or school setting, then we have some of those leaders. We have nutrition directors. We have those other leaders within the school building, and some of these centers that are doing some amazing work.
Awesome.
Can I interject and ask a question really quick?
Yeah, please.
I've heard everybody say food desert. Is anybody familiar with, and have you started to have language around food swamp? A food swamp is there's plenty of food around, but it's so nutritional devoid, kind of like using the biotic, abiotic. It's a suffocation and oversaturation and heavy disease forming
yes
phenomenon.
yeah, I've definitely started to hear that term. And Sharon, sit tight because I have another follow-up question for you. But this tickles something in my brain because I was hearing in a meeting some of us were in earlier this morning about Black maternal health in Georgia, and they were talking about maternity care deserts, and we hear about food deserts, and I know those are and food swamps, as you just elevated, and those are metaphors we use, and those are ways to convey to the general public kind of what we're talking about. But I go in another direction with those because deserts and swamps are natural ecosystems that perform the way they're supposed to in the environment. And so if we really start to interrogate some of those frames and metaphors we use, I think we might come up against a place that I don't know where I'm going with that, but I think it's worth noting that even in our shorthand of things, we're referencing systems that are a ecological desert is designed to function, and life still thrives in those habitats, just in a different way because it interacts with the environment that it's given in a different way. And so I think this is not the place for it. But I went on that tangent because it was very much top of mind after hearing about maternity care deserts this morning, and just thinking about, if we lean into those even further, what kind of questions would we be asking? How would we be thinking about these, if we're comparing to natural systems that, exist, and swamps are things. Swamps are, Okefenokee Swamp is a beautiful thing that we have. So, using that as a metaphor for a negative type of food environment, it conveys the message, but if we take a systems view of that message, what does it look like? And I know that might have just opened up a whole tangent of thoughts, but Paula, is this a reaction to that?
Yeah, and for probably 4 years now, we've been using food apartheid because you're exactly right. Like, deserts are not what they are, because we created them. People created this space. So we call it apartheid, food apartheid areas.
Thank you. And that's much stronger language that probably has different connotations, different folks. And so again, thinking about the communication systems aspect of these systems we're working in. So just a little tangent there. And Michelle, thanks for raising that, because there's different ways to talk about this. But Sharon, I'm gonna come back to you and ask, because I know you've done some. Can you just want to share from the SHAPE work kind of a real specific at a school setting, a policy systems or environment change that you helped one of the schools implement, just to sort of give an example, a concrete example from one of those settings?
Sure. So let's see here, from nutrition. I would say the farm to school was a big one. We had so many schools that were using grant funding to either start a brand new garden, or they were trying to expand, and they needed the materials and the equipment to do that. So essentially that's what we would provide, along with technical assistance. And with that, they were able to harvest the fruits and vegetables and have some awesome taste testing experiences. So that's a process. But as a result of those taste tests, what would be the long-term change, right? The ultimate goal being a policy change. So, for example, a school might taste test I'm just going to say smoothies, because that's always fun for kids, and they might want to have that change in the nutrition menu. So through the taste test results, working with the cafeteria manager, and then ultimately with that nutrition director at the district, they add that to the menu. So you have that long-term policy change of, okay, we've added smoothies to the menu. We're able to work with the school garden and either provide ongoing taste tests, but also just exposing those students to the new fruits and vegetables they may not have access to at home. And then also there's some education changes happening there too, with their families and their parents at home as well.
Yeah, great. Thank you for sharing that. As I wanted to get at some of that again, because all these, how do you get farm to school? That's a transportation system. That's a land use system. How do you get it into the walls, in a district? That's a district policy. That's a district system. How do you get it into the school itself? Those are systems and norms in there to have the taste test to influence the policy at the district level or in a school setting. Yes, Debbie.
I just wanted to, Sharon mentioned something that triggered for me. Every one of you have been working at various places around the state, and we know that there are geographic differences. And I didn't mention that at the beginning, But I did want to let you know that within the SPAN application, we had talked about taking action not only in populations that are experiencing disparities, but also geographic regions that are experiencing disparities. And we are trying to work with the REACH awardees to actually think about where we have can join forces to have impact in specific geographic regions. So for those of you working in rural areas of the state, I think about sharing your comment about the school districts, because we remember we talked to the Department of Education about the fact that for many of those food service delivery organizations, whether it's Cisco or others, they're not willing to go that last few miles to get to a rural school district. So their access to healthier food options may be compromised because they aren't generating enough revenue for that food service organization to actually deliver. So there's a lot of things here that can happen to either support or to make the food system accessibility worse. And rurality is one of those that we need to take action on. And I know I'm in a town of 600 right now, everybody with my dad. And this is a huge issue here. And I know we have many spots in Georgia that are experiencing the same challenges. So geographic areas matter. And I know many of you are passionate like us about rural action.
Yeah, thanks for adding that, Debbie. All right, who would like to share next?
Hey, good afternoon, everyone. This is Cheryl Steep with the Greater Atlanta Dietetic Association. So, sorry, I too am multitasking. I'm traveling for my day job today, so on the road. But just wanted to chime in quickly. I know Sharon had mentioned GATA and GAND, but what our organization is working on, we work in the Greater Atlanta area. We represent dietitians and nutrition students. What we try to do is help connect dietitians who, are food nutrition experts, who work in several different areas: pediatric, geriatric, adult, school nutrition, food policy, education, into public health initiatives where food nutrition issues are being addressed. So like I said, I'm looking at the questions. Like I said, we work in a lot of different areas. We serve a lot of different types of populations. And I guess for us, our measure of success is like I said, seeing more dietitians involved in public policy, especially when issues related to food and nutrition are being addressed.
Cheryl, one of the other things I think we've talked about with you is about just workforce shortages, right? We have workforce shortages. And so that's another space where we are trying to do better, and maybe this effort can help support that, as well as we think about pre-service learning initiatives that maybe we can contribute to.
Absolutely. Great point, Debbie. And to sort of add on to that, we partner with the nutrition education programs in the Greater Atlanta area with Georgia State and Emory. So we're always working to pull in students as well.
Thank you, Cheryl.
Thank you.
Who else would like to go? Or, oh, I see.
Hello.
Yes.
Hi, I'm Dr. Thomas. I am here representing the Georgia Academy of Nutrition and Dietetics. I'm the president. So since Cheryl and Sharon both spoke, I think I'll go ahead and kind of sum it up. And so we all work collaboratively. And what we are, currently doing is we have our public policy committee that's working to, right now, one of the major projects that we have is the Nutrition Security Task Force. And we have also had some interaction. Of course, we have a lobbyist as well in the association, and we have connected with the Commission of Agriculture. And we have been working on a specific project which will help us to stretch out across the state of Georgia to reach areas, of course, rural areas, and of course, to help to decrease our inequities of getting medical nutrition therapy and having access to dietitians. We serve all of Georgia, and our focus is right now is of course with policies and implementing policies, getting policies implemented in the state of Georgia to help in these areas, because as associations, that's what we do. But however, just like Cheryl mentioned, we have all dietitians, so our Georgia Academy is divided up into districts and regions, and so we have a variety of clinical dietitians, food service dietitians, community health, WIC, dialysis, educators, academics, you name it. We have a little bit of everybody involved, and in that piece, we have the ability to reach many areas. We, like I said, have been working with local representatives. The public policy section has, in hopes to increase our ability to provide access to the community, the population of Georgia. And so how we're measuring that, of course, like many others have said, is right now is participation. Someone mentioned, I think it was Deborah mentioned earlier, about not having enough employees, not even having enough volunteers. This is a good outcome just to be on this meeting today, because volunteer is at its lowest, just the same as employment is. And we know that there's a need, and just reaching out to others, nutrition professionals, to get them involved is a task in itself. So that's where we are for the Academy of Nutrition and Dietetics.
Awesome.
And we'll be having our conference in March 13th, 14th, and 15th. 13th will be actually a free presentation or training that's going on by Children's Healthcare of Atlanta. It'll be at Eggleston. 13th and 14th will be our actual conference. But I say that because we'll also have pieces of education in there where we talk about these things. And on one day will be a half day of public policy interaction. So those who may be interested, please try to join us. Thank you.
Awesome. Thanks for all that. I got 3 follow-ups for you. One, put that information in the chat for everybody about your conference. I think that it would be great for people to see.
Okay.
And you might have said, and I missed it, but because I'm not a nutrition side, I'm a nutrition security. What exactly is that?
So basically just making sure that everybody has access to healthy food. And when we talk about just not the food, but food and nutrition, so the nutrition education that goes along with it. And then, of course, those that registered dietitians or provide medical nutrition therapy, that piece right there indicates the disease part, because we have the fitness and wellness piece that is really not guarded. But when you come into interaction with people who have diabetes, high blood pressure, other cardiovascular disease, cancer, dialysis, things like that, the education is required to be done by a registered dietitian. And so we want to make sure that the proper nutrition education is being done, and that nutrition in itself and food availability is there.
Yeah, great. I just wanted to ask on that. Just kind of want to say, there's the food insecurity is you don't have access to it, but I always want to make sure we weren't talking, like security of the supply chain, or making sure that.
And that's funny that you mentioned that, because when we had our meeting with the Commission of Agriculture, that was the way that he went with that. And so it's a lot of things that people are not aware of when it comes when we are talking about nutrition security, of just how it's infiltrated to try to get fresh fruits and vegetables from other places in here, not Georgia grown, but even outside of Georgia, where other things are taking place that may delay that, or without saying too much, it may not even allow us to be able to use those foods. So there's that piece of nutrition security just the same.
Yeah, and that's totally asking, because those are perspectives too that are a part of that. And security can mean different thing to different people, and that's, you know,
Yes, and unfortunately, the food chain, like in that capacity, it has been used for other reasons, to smuggle drugs in and different things. So yeah, it's a phrase, but it has many meanings. You're
Yeah.
correct.
Great, thank you for sharing that. And one part I wanted to just riff on a little bit. You mentioned you guys have districts around the state, and just in the interest of time, I'm not going to ask everybody to weigh in, but I imagine everybody on this meeting has had some version of different geographic districts, be it public health districts or community development districts or water service districts, agricultural districts, that all those boundaries, geographic boundaries, are slightly different, and that can make collaboration sometimes more of a challenge. So as we think about the boundaries of our systems that we work in and the boundaries we're collectively working in, thinking about, kind of going again on the different meanings of words, that can mean very much a boundary in space. A boundary on a map can be the boundary of the system we're talking about, in addition to the boundary of the type of content we're talking and working with. So just wanted to raise that again. And then Allie, I saw you come on video. Does that mean you're willing to share?
Sure, I'd be happy to. Can you hear me okay?
Yes.
Yeah, so I wear many hats, and I think I'm going to represent a few of those today. So we have a line for the University of Georgia as a CDC HOP recipient. We have had that funding since 2016. And each round of the grant, our purview has expanded. So we started out with just 2 counties in the 2016 to 2018. We expanded to 5 counties in 2018 to 2023. And then in this round, we had, I don't even want to say what the number is eligible, but we chose to work in about 12 over the course of the grant period. And most of our counties are rural. And when I say rural, I mean like very rural. And so I think we're experiencing some of those issues about suppliers and grocery store chains and even smaller chains not wanting to go that extra mile to share healthy food with our communities. So I also serve as the Extension Nutrition and Health Specialist, and I'm a registered dietitian, so I oversee our direct education in nutrition and health, not all of it, but some of it. So while we are primarily a direct education organization, we are charged with bringing education to people of Georgia. Certainly being responsive to communities involves policy systems and environmental work as well. UGA SNAP-Ed has had specific funding for that, and they are on the call today. And we've done the PSE work and the food service guidelines over the past several years through the HOP grant, and we'll be continuing to do that. So I would say we're pretty broad in our reach, and we're really excited to hear about all these other organizations that are working in these spaces and to connect and make sure that we can leverage each other's strengths so that we're not duplicating efforts, but working smarter together.
Hey, thank you for all that. And I definitely want to shout out UGA Extension as a great partner in every county in the state, and in various capacities through my career. I've interacted with you all as an information source and a local trusted voice from UGA. And did you cover UGA SNAP-Ed, or is there somebody else on the call that would be that row?
I believe that Ed Okada Rivera is still on. Eda, are you on? Would you like to speak to that?
Allie, will you put the counties in the chat that you're going to be working in so everyone knows?
Yes, I will.
Thank you.
I don't know if Eda is still on. What I can share briefly about SNAP-Ed is that, of course, they have direct education, they have policy systems, environmental work around texting campaigns, billboard campaigns, working with schools on environmental interventions. And then also Dr. Jung-Sung Lee, who leads that effort, has been involved with Wholesome Wave Georgia to facilitate the Farm RX program in Athens specifically, and I think one other county perhaps. And Dr. Jung-Sung Lee also leads efforts around the Georgia Charitable Food System through partnership with Feeding Georgia, and some work that we have done recently to identify the providers around the state. So we all work hand in hand, and we all kind of touch different things.
Thank you. Dr. Lee, you want to add something?
Sure. Allie covers already.
Sorry, I didn't
we
see you on there.
collaborate closely for various projects, but we are one of the 5 implementing agencies under Georgia SNAP-Ed. I know Michaela and David, Teresa also on the call. So as Alice said, we started from 2013 and building the programming infrastructure in state and county team who deliver the various nutrition education, obesity prevention program targeted to low-income Georgians. So we have the in-person and also technology-based nutrition education programs, social marketing, and various PSC program different stage. So we really looking forward to working with you all and wanted to, great to know all the great programs and people working on this space.
Great. Thank you, UGA crew, for sharing. Let's see. In the interest of time, I'm just gonna jump down. Who's on representing USDA and did the row there? And would you like to share? USDA. All right. Hearing none. And I'm seeing in the chat that some people are having trouble coming off mute. We apologize for that. I don't know what's going on with the technology there. But if you have thoughts and are unable to unmute yourself, please just pop them in the chat and we'll be sure to catch them. How about Open Hand Atlanta? Anybody from Open Hand Atlanta still on that would like to share?
Yes. Can you hear me?
Yes, so let it go right ahead.
Okay. Let me see if I can find my chart. So I'm Alita McLean. I'm the Senior Director of Client Services with Open Hand. And we're a community-based nutrition service provider providing medically tailored meals and nutrition education and counseling throughout the state of Georgia. So I put for our policy systems and environmental activities of making healthy food more accessible, because we do deliver our services throughout the community. So our main focus is about 19 counties within Metro Atlanta, and then we ship meals to rural parts of Georgia through some of for referrals that we receive in like the Tifton, Valdosta, and Savannah areas. We also do nutrition education and counseling. We have a team of registered dietitians that not only prepare our meal services, but that conduct our education. So we're a provider of medical nutrition therapy. We receive SNAP Ed funding and do direct nutrition education. We've done work with early child care centers. So we are providing technical assistance to ECE sites on incorporating fresh fruits and vegetables in their menu planning, and also done some work with them in terms of procurement. We've done work with some WIC clinics providing technical assistance as they carry out some of their direct nutrition education. We do produce prescription programs throughout the state of Georgia. So our focus has been increasing fruit and vegetables intake among those individuals and helping to improve health outcomes. For our produce prescriptions, we've been partnering with a lot of health systems to help them improve their health outcomes for that particular program. What was the other category?
Success.
Oh, success. So I would say that's a kind of hard question to answer, but we do evaluation of our programming. So we do some key informant interviews with people that we provide services to. We survey them to kind of make sure that the services we're providing are still the services that are in demand and what's needed. But we also, like I said, since we partner with some medical providers, we're also looking to see if we're making any changes in their health outcomes, and we're looking at changes in behavior and knowledge for the participants who are receiving our nutrition education programming, because we want them to be able to retain that information, but to continue these lifestyle changes post the program, and any other initiatives we provide.
Awesome. Thank you for sharing all that. And
Jimmy, can I just mention one more thing that I think Alita's doing that's really, really important as we think about the work? Alita, thank you for sharing. One of the other things I think the Open Hand has been really working hard on, along with all of the partners with whom you collaborate, right, on Food as Medicine, is trying to change insurance coverage for coverage of medically tailored meals. And this is a really important outcome in action that our state could be supporting Open Hand in doing, because more health systems covering meals that are designed for individuals with specific chronic conditions means better outcomes for those individuals. So this is a policy example within a system that I think we could actually support Open Hand, Wholesome Wave, and others who are working in the medically tailored meal field to support. That's in addition to what we're doing for the SPAN work.
Yes, thank you for that.
Great, thank you, Debbie. And now, kind of we're getting close on time because this is the biggest group we've done. So I'm gonna guide us through maybe a little more quickly, but just start going down the list. Atlanta Community Food Bank. Anything you want to share about your role?
Hi, Megan Middleton, Director of Government Affairs. I apologize when I was answering this. I probably need 2 more colleagues on this. So I handle government. So I'm the lobbyist for this Atlanta Community Food Bank. So some of my answers are different than some would be from my colleagues, but we service a 29 county area in North and Northwest Georgia, crossover at least 9 congressional districts. So that keeps me pretty busy on the policy side. I'm very focused right now on the Farm Bill and the policies that fall in that. In addition to that, trying to get more funding for WIC. That's the short answer. I also, especially right now, this time of year, focus on state legislative initiatives. What else do we work with? So as the food bank for this area, we work with 700 partner agencies within those 29 counties, and that includes churches, non-religious groups, community organizations, school pantries that we help provide food for. And so that's the overall of who we work with and where we work. We also have 2 dietitians on staff. They provide, information and help, and one of them should probably be on the call here with me, but also one of them about every 2 to 3 weeks basically does recipes and cooking, which you can follow on our Facebook page and also our YouTube channel. And it helps people to, like this week, it's going to be about how to bring heart healthy walnuts into your life and into your menu, but other times it's about how to cook, something that a lot of us may not be familiar with, that shows up in food boxes that we receive from USDA. So that's one way that we work with the communities we serve. We also have a benefits outreach program, and they go to, we have them on call, at the food bank that we take calls in, just take calls in, but we also have our members that go out to our partner agencies and sign people up for SNAP, WIC, Medicaid, help them find other resources where we may not be the person to, help with rental assistance, but we have resources where they can reach out and hopefully get help with that. So that's something we want to make sure that, people are well cared for in all aspects of their lives. So that's, another area where someone with more expertise in that could probably help provide more information. See, specific populations, we pretty much, serve everybody that is in need. Our main focus is getting people the nutritious food that they need, and also to help them to rely on us as something that, and I've heard a couple of other members here say that too. Rely on us, know that they can come to us, and kind of take that off of their worry list for a little while and come to us, come to the food pantry that's close to you, close to your work, close to your school, while you work on the other things that, may need some attention in their lives. And then as far as success, I kind of had my mind somewhere else when I answered this. So we do, we keep a meals data, like meals per month served based on the food that comes in. Or pounds distributed. For me, sometimes though, it's more of did I get the legislation passed that we wanted, or was I any help in it, not just me? Or were we able to maybe beat back some legislation that was bad? So there's different types that types of data that we use to, claim success. So hopefully that was helpful.
Yeah, it was very helpful. Thank you for sharing all that. And those others that work with you who could provide different answers, feel free to shoot them the spreadsheet so they can get in there and just ask them to add to your row, their perspective. And I think it's all helpful to hear. So thank you very much. Anyone still on from Strong for Life, Children's Healthcare?
Wendy had to hop off.
Yeah. All right. How about Cobb, Douglas Public Health?
Hi, this is Allison Curtis.
Hi, Allison.
So I think Kia very well covered everything. So I am obviously within one of the districts within the Department of Public Health. And as she was saying, each district can do a little bit of different work depending on what the needs are or what their capacity is within their communities. So for us, some of the things that we've been working closely on is after Douglasville had lost their former farmers market, we worked to get a farmers market established, and that is through SNAP as well as the doubling program with Georgia Fresh for Less, trying to work with food pantries, really just trying to get community members connected to know where they can get access, trying to improve those connections, trying to help support local farmers. So just kind of some of those different areas. We have the Cobb 2020 and Live Healthy Douglas coalitions, and I know Jasmine and Jessica are not able to be on the call today, but they do, deeper work with additional partners on some of the bigger picture. But really just a lot of focus too on PSE changes, whatever we can do. A lot of it is just all connected through partnerships.
Awesome. Thank you. And is that Cobb 2020, is that a health specific initiative, or is that like the Cobb Comprehensive Plan, big picture, Cobb County?
So it's for Cobb County, there's different subsects. So there's different implementation groups, but there is kind of a healthy behaviors focused one. And so that one specifically does address nutrition and physical activity and tobacco.
Great. Thank you. All right. Georgia Department of Human Services. Anybody still on from there?
Sure. Good afternoon. My name is Latrice Davenport. I'm with the SNAP Nutrition Education Program, and we manage the SNAP Nutrition Education and Obesity Prevention Grant Program for the state. We act in this space as funders, and so most of this work will be subcontracted out to other state or local implementing agencies, which is language that we use. Our scope is the state of Georgia. Our primary focus is on people who live at or below 185% of the federal poverty level. So that's typically people who are on SNAP, WIC, Medicaid, TANF, people whose children are on free or reduced lunch. Our work includes reaching a variety of folks. So, anywhere from early care and education centers, schools, out of school time settings, farmers markets, work sites, community gardens. It runs a gamut. And most of our work, like I said, it's in communities across the state of Georgia. And we measure success through, most of our work is through kind of nutrition education classes and combining that with policy systems and environmental changes and social marketing. And we measure success through a couple of methods, but mostly through our pre and post surveys from nutrition education classes, which include assessing the consumption of fruit and vegetable, the variety of fruit and vegetables consumed, reducing sugar, sweet and beverage consumption, improving food resource management skills. So that's the ability of folks not to run out of food by the end of the month, improving physical activity behaviors, increasing policy systems and environmental changes, improving community engagement opportunity, and addressing gaps in SNAP Ed service areas.
So you do a little bit. That's good. No, that's great work. And thank you so much for sharing it. And I'm learning here how different state agencies are interconnected around these topics. And you started off talking about position as kind of a funder, that you're moving funds out into the communities to do this work. And just want to make sure it's on people's radar that that's one of the things when we talk about mapping these systems, mapping the flow of resources, specifically financial resources through these systems, is part of what we want to be looking at, because following the money is often how you can follow the impact. So it's really, really critical, and we're real thankful to have you guys here that are representing some of that funding perspective. Gwinnett County, anybody still on from Gwinnett?
Hi, everyone. I am Karian. I represent Live Healthy Gwinnett, which is one of the departments of community services, one of our divisions. And so I'll briefly go through it since Lindsay's not able to be on the call. She's in a meeting right now. So with Gwinnett County Government Specifically to Nutrition, we have several different initiatives. So Volunteer Gwinnett does mobile distributions every single Tuesday. We've been doing it since, I would say, the pandemic, honestly, 3 weeks after COVID hit, and it's been rocking and rolling. And that's how we support families in need. We do this by going to communities that are near our parks, communities that have a large following within their faith-based congregation or a faith-based community in general, such as a mosque, churches, community centers, things of that sort. And that's where we distribute the food in partnership with Atlanta Community Food Bank. Of course, we service throughout Gwinnett County. That is our biggest population. We stay in Gwinnett County, where they do the food distributions. Like I mentioned before, it could be a faith-based community. It could be at an after-school program site. It could be at a child care center site, some of our senior centers. It's just various locations, but every other week we do have it at one of our beautiful 51 parks throughout Gwinnett. So that's amazing, so that the public can come out and participate in getting food. We don't ask them any personal information, anything of that sort. It's just come in, let us know how many people live in your household, and that's it. And they get as many food as they need, and they're on their way. And it's all drive-through style. So it's a really great service that we're thankful that we continue to do. All the age groups that we do serve, I would say it's seniors, it's adults, youth as well, when it comes to like our volunteers and the populations that come out to make this happen within our programs. A great partner to bring to the table. I mentioned Open Hand previously at our last meeting. I'm so happy they're able to be on today. Another partner I could think of is Diabetes You Could Win when it comes to nutrition education. I guess I'll dive into with Live Healthy Gwinnett, how we make this happen with our nutrition initiative. We focus on community gardens. And so as I mentioned previously in our last meeting, we have 11 community gardens. 10 of them are actually within our parks recreation. So they're actually inside of our parks. And how we support communities when it comes to nutrition is teaching families and youth as well how to cook and grow their own food. We partner heavily with UJ Extension Gwinnett when it comes to our educational services. They come in and teach the value of what we're growing, how it's important to cook food in this way, how to properly harvest the produce that we're growing within our garden, how to cook the produce. We bring out our amazing mobile kitchens, and they're able to use their knowledge to teach the families that come out to our community garden events how to cook the food that they can grow. And so it's been an amazing partnership, and we're so thankful that we're not only harvesting tons of food, but we're also able to teach people what to do with this healthy produce. We see a lot of the case where it's all about providing food to reduce food insecurity, but we want to make sure people know what to do when they receive these great items from their co-ops where we donate to, from our local health and human services, from our local food distributions that we do as well, in partnership with Volunteer Gwinnett. We want to make sure families know how to prepare healthy meals at home. And the last thing is, how do we measure our success? We do this by using the United Way's Child Wellbeing Map. It used to be known as the Child Wellbeing Score. And so we use that map to target areas that are in the highest need. And we know that we've done well is when those 22 neighborhoods that have been identified in Gwinnett County that are highest need neighborhoods, once those numbers reduce to less need, then that's where we are really aiming our target. So that's how we base all the work that we've been doing. If we're making sure they're reaching the families that are actually in need, we follow that index score and look at that and see, okay, this community is highest need right now in 2024. Hopefully in the next 5 years, we can get it down to less need. So they're no longer on that top list of counties in need, of cities within our county in need. That's it for us.
Thank you so much. And I'm going to, oh, there it is. Stop sharing. I'm going to hand it back to Debbie to wrap us up. Apologies if you wanted to share and didn't get a chance to, but we want to be sure we get done at 3 o'clock. And this has been a great conversation. I've been feel very privileged to have gotten to hear it and help facilitate through some of this conversation. Debbie, wrap us up, please.
Thank you. First of all, I just want to say thank you to everyone for populating, sharing. Nutrition is a topic that's passionate to us for many, and the fact that we, at a max, I think, had 36 or 37 people, and we're still at 31 speaks volumes about your commitment to the work that we're about to embark on. Many of you have been doing this work for years, as we already talked about at the beginning, and we are hoping to embrace and come together again, like we've done in the past on several initiatives to make a difference in Georgians in terms of nutrition. A couple of things I want to remind you about. We are shooting to try to get a third date for the Nutrition CAT convening before these sort of statewide April initiatives. So on the next meeting, we'll be talking about moving this systems map even further forward, so that for each collaborative action team, we're having these 2 meetings, we'll come to April with something that's more concrete, right? So we're ready and all at the same place for each CAT to come together, to merge, join, and think about a whole systems map. So second thing is we'll be deciding on that date for a third meeting of the Nutrition CAT. So please know that next meeting is not a repeat of this. It's actually continuing to move this work even further forward, so we get to a product that all of you feel is well informed in terms of the food system. Second thing I want to mention is this is an ongoing process. We're not recruiting and then stopping recruitment for nutrition. If you have someone that you know is passionate about nutrition and they want to participate, we welcome their engagement at any time. So this is not a one-time recruit. We want to get everybody into these nutrition discussions, and it's an ongoing process. So feel free to share any information, even forward the appointment that you have for the next event to them. The third thing I want to mention is that April convening on April 29th and 30th will be at the School of Law at GSU. We're working with our CDC funded partners. We'll cover some of their expenses, but we can't cover the expenses of everybody, but we can accommodate a pretty large group. So on that third CAT meeting, we're going to be talking about who might attend from the CAT for April 29th and 30th, so that people know that there's a variety and diverse set of voices in the room talking about the systems map we'll create for Georgia. Finally, in the chat, I'm just going to ask you to do one thing for me. What was the most valuable thing about this convening today? If you could just put in the chat for our team to understand what was valuable for you about today, to ensure that as we think about that design of the next 2 CAT meetings, we're meeting your needs for this. And if you felt there was a shortcoming, let us know that. Jimmy.
This is how we measure success. So
right. What did I forget, Jimmy?
Nothing. I got 3 o'clock. So if you want to pop that in the chat and head on out, and GHPC and other core folks, you want to stay on for a couple minutes if you're able to debrief. But otherwise,
thank you, everyone.
Thank you, everyone.
Thank you so much.